When our neck or our low back or our mid back get tight, it's important to improve the flexibility of those structures. And oftentimes the positions that make them tight, we need to go into the opposite direction in order to relieve that tightness. But unfortunately, what our tendency is to do is to go further into the position that makes it tight. For instance, if we've been sitting at a workstation working and the top of our back between our shoulder blades gets tight, we tend to want to stretch further into that position. Or if our low back is tight from sitting, we tend to want to stretch forward more so into flexion, and those are the positions that have made it stiff in the first place. So what we need to do is to extend and move backwards out of the position of tightness. So our stretching is designed to counteract the activities that make our spine and our muscles tight. So if you have tightness on the side of your neck, tuck your chin and lean it away from the side to be stretched and hold on to the bottom of your chair. The stretching comes from leaning your body and not by leaning first and then pulling your head. Avoid using your neck for a lever to stretch. So before the muscles are taut, position your neck and then elongate the muscles by holding the scapula down. So tuck first, lean away, and then lean your whole body away and stretch the muscles by depressing your shoulder. Avoid pulling on your head or turning towards the side that you are stretching. Although this may feel as though it increases the stretch, the neck mechanically is not designed to work this way, and you will actually perpetuate your stiffness and pain. When we have tightness and pain between our shoulder blades, oftentimes it is from this type of a flexed posture. And what we need to do is to counteract that with extension. So taking your arms and extending your wrists and elbows and reaching back and leaning back over the back of the chair and keeping your chin tucked. Avoid letting your head hang back. Lift your chest and arch your back over the back of the chair. And then exhale. This same maneuver can be performed with your hands behind your head and taking your elbows out and leaning back over the back of the chair. And you can move this repeatedly. Inhale. When you get back, exhale. You may feel some tingling into your hands when you stretch this way, but that's probably just the myofascial tissue stretching in your arms and in your chest. So we want to elongate these structures and mobilize our spine. If our low back is sore from sitting, what we want to do is to unload our spine. And that can be performed by either on a chair with supporting with your arms and releasing the support from your legs and just let your pelvis hang, almost as though it's dangling from your spine. And you can move a little bit and tilt forward and backwards, but your midsection should be relatively relaxed. And you should feel a pulling on your low back. If your low back is stiff from sitting, you should avoid stretching further and further into flexion, which is the position that aggravated it in the first place. Another method of unloading your back would be on a countertop and just unload the weight of your legs and just let your pelvis hang. If your low back is stiff from standing too long, then the motion that has made it stiff is the standing and the slight extension. So now you will want to stretch it more into flexion. So a technique that is helpful for that is place one leg up on a surface and bring your chest forward and bring your pelvis and hips forward. And just hold this stretch. And do it on both sides. Also, squatting down is a convenient way to stretch your low back if it's possible. Again, these flexion stretches are for tightness that results from standing too long. You may also want to do it in a chair, just bending forward this way. But the tightness that results in your low back demands different types of treatment. If the tightness results from sitting, you need to unload your back or even extend your back, because sitting is a flexed position. If the tightness in your low back is from standing or walking, that's more of an extended activity, and you want to stretch it by doing these flexion activities or bending forward activities.